Introduction. You have important responsibilities for protecting the health and safety of the people you support. Health and safety roles and responsibilities. Know the health and safety needs and concerns for the people you support. Follow universal precautions. As a mandated reporter, immediately report any concerns of abuse, neglect, or exploitation. Report changes in behavior, appearance, or habits that may relate to health and safety. Report injuries or other unusual events that are not consistent with the person's routine. Creating a culture of health and welfare. A culture of health and welfare is creating a safe place where the people being served and staff feel comfortable sharing concerns and making reports, in an effort to provide the best possible outcomes to people with developmental disabilities. Regardless of your role, whether you are a direct support professional, service and support administrator of a licensed residential facility, superintendent, or a director of operations of a provider agency, you all play a critical role in encouraging reporting, ensuring people are safe, and focusing on quality improvement. There are actions you can take to create and maintain a strong culture of health and welfare. These actions include implementing a system of reporting incidents that every level of the agency understands and knows what to do and when to do it. Plan for backup options and test the system to see where it might be weak, such as on weekends or when important team members aren't available. Putting the people being served at the center of your decisions. Maintaining, as much as possible, confidentiality and anonymity, especially when supporting and protecting witnesses. Knowing resources and cultivating relationships with county and other local service agencies. Encouraging team members to take care of people being served and each other. Encouraging people to be accountable for their actions, but also acknowledge that mistakes are opportunities for learning and improvement, and acting as an example to others at the agency or facility. Understanding UIs versus MUIs. An unusual incident, UI, is an unusual event that is not consistent with a person's routine or Ohio Individual Service Plan, Ohio ISP, but does not pose a significant risk to a person's health or safety. Examples of UIs include unapproved behavioral supports without a likely risk to health and welfare, dental injury that does not require treatment by a dentist, a medication error that does not pose a major risk to a person's health, such as a person given an extra dose of aspirin, falling and scraping a knee, emergency room or urgent care treatment center visits that do not result in hospital admission, or automobile accidents that do not cause harm to the person. Types of UIs. Dental injury, such as chipped or loose tooth that doesn't require treatment by a dentist. Falls. For example, a person stumbles on the last step of a staircase and falls to the floor, but the person is not injured. Injury. An injury that is not a significant injury MUI. For example, a person's hair is pulled. Medication error. Medication error without a likely risk to a person's health and welfare. For example, a person receives their routine medication 2 hours late, and the medication information advises to give the medication late rather than skip. Missing person. A situation where a person's whereabouts are unknown for longer than the period of time specified in the individual service plan. That does not result in imminent risk of harm to the person or others and is not an MUI. Overnight relocation. Overnight relocation due to fire, natural disaster, or mechanical failure. For example, there is a lightning strike on a home, the power will be off for a week for repair, and the residents temporarily move to another house. Peer-to-peer act. A peer-to-peer act that is not an MUI. For example, Two roommates get into an argument and one picks up an object and throws it at the other, hitting their arm and causing a small scratch. Program implementation. Program implementation is the failure to carry out a person-centered plan when the failure causes minimal or no risk. For example, a person is left without supervision for 20 minutes, but their plan states that they cannot be without supervision for more than 15 minutes. There was no injury and minimal risk to a person's safety. Rights code violation. A rights code violation without a likely risk to a person's health and safety. For example, a person is told they cannot have a second glass of milk at dinner. Unapproved behavioral support. An unapproved behavioral support without a likely risk to the person's health and welfare. For example, a DSP redirects a person who is picking at a sore on their face by briefly placing their hands on top of the person's hands. The person does not resist. All providers are required to have written policies and procedures for reporting and investigating unusual incidents. Direct support professionals must be trained on procedures for documenting and reporting UIs by the agency. A major unusual incident, or MUI, is the alleged, suspected, or the actual occurrence of an incident that poses a reasonable risk to a person's health or safety. MUIs could include physical, emotional, and sexual abuse, neglect, exploitation, unanticipated hospitalization, and significant injuries, such as a concussion or a broken bone. Types of MUIs. Attempted suicide, when a person physically attempts to take their own life, and it results in emergency room treatment, inpatient observation, or hospital admission. Death other than unexplained or unanticipated death. Death of a person by natural causes. Emotional abuse, the use of actions, words, gestures, or other communicative means to purposefully threaten, coerce, intimidate, harass, or humiliate a person, or a pattern of behavior that creates a hostile environment. Exploitation, the unlawful or improper use of a person's resources for monetary or personal benefit, profit, or gain. Failure to report, the failure to report abuse or neglect that resulted in a substantial risk of harm. Law enforcement, any incident that results in the person being tased, arrested, charged, or incarcerated. Medical emergency, an incident where emergency medical intervention by a developmental disabilities employee is required to save a person's life. For example, the use of choking relief techniques, cardiopulmonary resuscitation, use of an automated external defibrillator, or administration of overdose reversal medication, such as Narcan. Misappropriation, the act of depriving, defrauding, or obtaining a person's property. Missing person, an incident when law enforcement has been contacted because a person's whereabouts are unknown and the person is believed to be at or pose an imminent risk of harm to self or others. Neglect, an incident where there is a duty to provide a person with medical care, personal care, or other support or services, and the failure to do so results in serious injury or places that person or another person at risk of serious injury. Peer-to-peer act, exploitation, theft, or a sexual or physical act between two people served. A physical act regarding the peer-to-peer act MUI is a physical altercation that results in examination or treatment by a physician, physician assistant, or nurse practitioner, involves strangulation, bloody nose, bloody lip, black eye, concussion, or a bite that causes breaking of the skin or results in a person being arrested, incarcerated, or the subject of criminal charges. Physical abuse. Physical force that is reasonably expected to result in harm. Prohibited sexual relations. Consensual sexual conduct or contact between a developmental disabilities employee and a person who is not their spouse, and for whom the developmental disabilities employee was employed or under contract to provide care or supervise the provision of care at the time of the incident. Rights Code violation. Violation of the rights enumerated in ORC 5123.62 that creates a likely risk of harm to health or welfare. Sexual abuse. Unlawful sexual contact or conduct, including public indecency and voyeurism. Significant injury. Injury to a person of known cause or unknown cause that results in a dental injury that requires treatment by a dentist, concussion, broken bone dislocation, or second or third degree burns, or that requires immobilization, casting, or 5 or more sutures. A significant injury will be designated in the Ohio Incident Tracking and Monitoring System as either known cause or unknown cause. Unanticipated hospitalization. An unplanned hospital stay of 48 hours or more that is not part of a scheduled test, procedure, or routine care and is either a first-time admission caused by aspiration pneumonia, bowel obstruction, dehydration, medication error, seizure, or sepsis, or a readmission, also 48 hours or more, for the same diagnosis as a hospital stay of 48 hours or more that occurred within the previous 30 days. Unapproved behavioral support. The use of a prohibited measure or the use of a restrictive measure not approved by a human rights committee that results in a risk to the person's health and welfare. Unexplained or unanticipated death. The death of a person resulting from an accident or suspicious circumstances. MUIs are categorized into 19 different types. The categories have different procedures to make sure they are investigated and or reviewed thoroughly, and as part of a quality improvement process. Most MUIs are administrative investigations, while 3 types, law enforcement, unanticipated hospitalizations, and unapproved behavioral supports, are considered administration reviews. Providers need to complete UI investigations, so it is important to know the difference between UIs and MUIs and what you are required to report. High-quality UI investigations can help reduce further incidents, prevent injuries of people being served and staff, and minimize costs to provider agencies. Immediate actions. The first thing that should be done after seeing or being told about a UI or MUI is to take immediate action to protect the health and safety of the person. The immediate action taken will depend on the circumstances. They can include things like checking for injuries, performing CPR, calling 911, taking the person to the emergency room, calling poison control, initiating first aid, or separating people who are physically fighting. As a DOO, superintendent, or administrator, you will likely not be responsible for completing these tasks like DSPs are, but you are responsible for ensuring they happen. Take immediate actions. Write an incident report. Notify the person's guardian and others as specified in the Ohio ISP. Notify other providers when necessary for continuity of care. Identify what caused the incident and what may have contributed to it. Investigate the UI as required and send it to the local county Board of Developmental Disabilities upon request. If you feel there is an MUI allegation at any time during the process, or you have questions or concerns, stop and consult with your local county board. Collaborate on the development of prevention plan and implement. Always document what actions were taken to ensure the health and welfare of any at-risk individuals on the incident report. Complete UI logs monthly and review for patterns and trends. Take corrective actions for trends. Send UI logs to the county board upon request. Work with the team to ensure that risks associated with UIs are addressed in the plan. A provider's role in MUI is very similar to responsibilities with UI, but there are some significant differences due to the severity of the situation. Take immediate actions. This could include medical attention, removal of an employee with direct contact with any person when the employee is alleged to have been involved in physical or sexual abuse, until the provider has reasonably determined that removal is no longer necessary. Other necessary measures to protect a person's health and welfare. Write an incident report. Report to appropriate entities. MUI notifications reviewed later in this course. Cooperate with MUI investigation by promptly providing requested documentation, being available for interviews, and responding to calls and emails in a timely manner. MUIs and UIs require documentation that includes information about the incident, such as the person's name, description of the incident, and the immediate action taken to protect the person. MUI and UI documentation reports should be clear, legible, and easy to read. DODD created a form that contains all the required elements of an incident report. Agency providers often have their own forms for documenting UIs and MUIs, so DSPs that work for agencies may see different versions depending on where they work. Required elements of incident reports. Required elements of incident reports include person's name, person's address, date and time of incident, location of incident, description of the incident, name of person completing the report, type and location of injuries, immediate action that was taken to protect the person. The primary person involved, also known as the alleged perpetrator, and their relationship to the person, witnesses, and statements completed by a person who witnessed the incident or had personal knowledge. Scenario: documenting an MUI. Jose arrives home from work and complains of severe stomach pains, is sweating, and has a fever. He reports not having a bowel movement for days. His DSP calls 911 and EMTs take him to the hospital. Jose is admitted to the hospital for 4 days due to a bowel obstruction. Name of person completing the report: Ariana Thompson. Person's name and address: Jose Martinez, 20 State Street, Lancaster, Fairfield. Date and time of incident: June 6, 2025, 5:50 p.m. Location of incident: living room, at home. Description of the incident: when he came home from work this afternoon, Jose complained of stomach pains. He had a fever. I called 911 and Jose was admitted to the hospital. The doctors diagnosed him with a bowel obstruction. Type and location of injury: stomach pains, fever, sweating. Immediate action taken to help the person: checked temperature, called 911, helped Jose to couch. PPI and A. Witnesses: Ariana Thompson, DSP; Daniel Keller, roommate. Notification: Sharon Hollis, DSP supervisor. June 6, 2025, at 6:30 p.m. Any notifications made to people should include their name, title, and date and time the notification was made. DSPs and other staff employed in direct services positions should report possible MUIs as soon as they can. Some MUIs are required to be reported within 4 hours after the incident or discovery of the incident. Those are unexplained or unanticipated death, exploitation, misappropriation, neglect, peer-to-peer act, physical abuse, prohibited sexual relations, sexual abuse, and emotional abuse. DSPs working for an agency, including ICF IIDs. Agency providers are required to have written policies and procedures for reporting and investigating UIs. DSPs who work for agencies are trained on procedures for documenting and reporting UIs by their agency. All DSPs are required to complete incident reports. DSPs who work for agencies should check with their supervisor regarding their process for documenting and reporting MUIs. DSPs are required to cooperate with administrative investigations and administrative reviews by promptly providing requested documentation, being available for interviews, and responding to calls and emails in a timely manner. Independent providers. Independent providers must maintain a log of all UIs that includes all of the required elements of the incident reports and any preventive measures that were put in place to prevent the incident from happening again. See the resources section of the DoDD My Learning homepage for this course to view an example of a UI log. Independent providers are required to review all UIs at least once per month to ensure appropriate preventive measures were implemented and to identify patterns or trends. Make reports, documentation of identified trends and patterns, and corrective action available to County Boards of Developmental Disabilities and/or DoDD upon request. Cooperate with administrative investigations and administrative reviews by promptly providing requested documentation, being available for interviews, and responding to calls and emails in a timely manner. For MUIs, each County Board of Developmental Disabilities has a designated person to receive reports of MUIs. Reports may be made to the designated MUI county contact, online, or any county board employee. A link to this information on the DoDD website is available in the resources section of this course on DoDD My Learning. If there are concerns about reporting to the county board, call DoDD's hotline at 1-800-617-6733, option 1, available Monday through Friday during business hours. Service and Support Administrators. If a Service and Support Administrator, or SSA, becomes aware of a possible MUI via email, during a call, at a meeting, or during a home visit, they must follow their county's process for reporting MUIs. SSAs are required to cooperate with administrative investigations and administrative reviews by promptly providing requested documentation, being available for interviews, and responding to calls and emails in a timely manner. Director of Operations and Administrators of Licensed Residential Facilities. The Director of Operations and the administrators of licensed residential facilities are required to cooperate with administrative investigations and administrative reviews. The provider should make the following notifications on the same day that the MUI happens or is discovered. When making the notifications, the provider should include what immediate actions have been taken. Notifications should be made to the guardian or another person whom the person has identified, the person's service and support administrator, or SSE, other providers of services as necessary to ensure continuity of care and support for a person. The Director of Operations and the administrators of licensed residential facilities should ensure that Appendix Forms C through E are completed and submitted when applicable. Director of Operations notifications within 1 working day following the day staff become aware of a potential or determined major unusual incident involving misappropriation, neglect, physical abuse, or sexual abuse. All notifications must be documented. Carmen is an independent provider who has been working with Alvin for a few weeks. Alvin's service plan requires him to have visual supervision, meaning DSPs must be able to see Alvin and be able to provide support or direction. After shopping for groceries, Alvin and Carmen head to the checkout line. As Carmen pays the cashier, Alvin walks away. Before he can make it to the front door, Carmen catches up to him. She checks that he's okay and talks to him about why he walked away and how they can stay together next time. Later, Carmen completes an incident report, informs Alvin's SSA, and emails the incident report to Alvin's SSA. Finally, Carmen logs the incident in the UI log. Martin is a DSP who has been working with Brooke for a couple of years. Brooke is dropped off at home. She lets herself in and discovers her DSP Martin is not there to greet her, as usual. She retrieves a snack from the refrigerator and goes about her afternoon routine. About 30 minutes later, Martin arrives. Due to heavy traffic, he is late. Martin checks on Brooke to make sure she is safe and does not need anything. Following his agency's procedures, he calls his supervisor to let him know about his late arrival. Later, Martin files an incident report with his agency's UI administrator, who adds it to the agency's UI log. MUI as a quality improvement process. Previously, you learned about identifying UIs and MUIs and creating a culture of health and welfare. Part of creating this culture is promoting a system of accountability that encourages reporting, learning from mistakes, and improving safety to prevent harm. At its core, the MUI process is a quality improvement process. The goal of the MUI system is to gather information to better support people receiving services. The MUI system helps everyone learn from what has taken place and makes procedures and services better and safe. After an incident, the UI and MUI process has four main parts: immediate action, investigation, identifying causes and contributing factors, and prevention planning. Immediate actions. As you learned earlier, the first thing a provider should do after seeing or being told about a UI or MUI is to take immediate action to protect the health and safety of the person and anyone else at risk. The immediate actions taken will depend on the circumstances. MUI and UI investigations and reviews. MUI and UI investigations and reviews determine what happened during the event. The goal of the investigation or review is to identify what caused the incident and contributed to it. Having this information is integral in the creation of a prevention plan that decreases the chances of it happening again, improves outcomes for people served, minimizes the risk of injury for all involved, improves working conditions through additional training, enhanced procedures, better equipment, and additional supports, and focuses on outcomes. Steps in UI investigations. Review the incident report. Does the information given by staff explain who, what, when, where, and what happened before the incident? Review other related documentation, such as medication administration records, staff notes, the person's Ohio ISP, training records, or nursing notes. Conduct interviews with anyone involved in the incident, people served, family members, staff, and medical personnel. Review scene and check equipment for environmental or mechanical failures. MUI investigations. All reports of MUIs require an investigation. The ultimate goal of the investigation is to make sure people with developmental disabilities are healthy and safe. To reach this goal, the investigation into a possible MUI works to identify the causes and contributing factors of the incident. This information is used to put a prevention plan in place to help reduce the likelihood of the incident happening again. Whoever is investigating the incident, whether the identifying intermediate care facility personnel or a certified investigative agent from a county board or council of governments, will try to identify what caused it or what contributed to it, so it can be prevented from happening again. A cause or contributing factor can include a lack of communication between DSPs, someone not being appropriately trained, or someone not having the required tools or support to carry out a specific task. Depending on the allegation, if a staff member is a primary person involved, or PPI, they may be placed on administrative leave during the MUI investigation. This does not mean they have done anything or are being reprimanded. It is done to protect the staff and the person supported during the investigation process. Removal of the PPI is required for all allegations of physical and sexual abuse. Understand your role in the quality improvement and incident process. How can you support people being served and staff who are involved in an investigation? Explain the process and why investigations are done. The MUI process is a quality improvement process with a focus on prevention. It is not and should not be a fear-driven system. Commit to being calm and professional with your team and others involved in the investigation. Cooperate and provide needed information as quickly as possible. Keep the county board updated on any protective action changes, like when an employee has been placed on leave or returned. The county board should also keep the provider informed of the status of the investigation.
Hi, I'm Sarah Deesh, and I work for the Lucas County Board of Developmental Disabilities. Currently, I'm the Director of Provider Supports, but I started at the county board as an investigative agent, and then I moved into the coordinator role, which I've done for the last 20 years. So an investigative agent does major unusual incident investigations. There's 19 different categories that we investigate, and they take all of the information. They go and talk to the individual, they talk to the staff that are involved, they gather all of the information of what happened, with the main purpose of an investigation being prevention. How do we make sure that that individual remains safe and that that type of incident doesn't occur again? Staff begin working with individuals because they want to do the right thing. They care about the individuals. Being a part of an MUI investigation is just another thing that occurs during the course of your job. We investigate 19 different categories, from somebody being hospitalized to maybe staff having to do an intervention to keep the person safe. That doesn't mean that anything happened that shouldn't have happened. You did the right thing. We still have to look into that to make sure that we have in place everything that's needed for that individual. So we might get a call from a family, from a community member, from a provider that reports that an incident occurred. And that is just a little tiny piece. We get told that, this person was alleged to have hit the individual. First, I'm going to look at the individual's Ohio service plan. Then I'm going to gather whatever information I have. Maybe an incident report was written, so I'm going to ask for that. I'm going to do all of that first before I go out and I talk to anybody. Then I'm going to go talk to the individual to see what information they can provide me, what happened in their opinion. Then I'm going to look at the scene to see. Sometimes we have people tell us something, and when we go to the scene, there's no way that you could have seen that based on where people were. So we're going to look at the scene to figure out where everybody was, exactly what was happening. Then we're going to do interviews of everyone that was involved. So we might have a couple of witnesses, maybe there's other individuals that live in the home, and that's where the incident happened, so we're going to talk to them. And then we're going to talk to the PPI last. After that, we're going to review all of the documentation that we have. And then we're going to make a decision on whether we're going to substantiate or unsubstantiate the incident. Once we do that, we're going to give that information to the provider agency that employs that staff person. We're going to either tell them, yes, we substantiated the incident, and we're going to give them the findings. So what did we find out during the investigation? And that's going to include, why did the incident happen? What is the root cause? What happened? What contributed to make that incident happen? And then we're going to ask for prevention. And then the investigator is going to put all of that into a report and submit that to the state. If it's substantiated, and it's substantiated against a staff person that works for a provider, then it might go to the abuser registry. If it's a significant enough incident, and there's enough evidence to say that the incident occurred as alleged, then it goes through the abuser registry process.
It is important to identify the causes and contributing factors to prevent the incident from occurring again. Cause and contributing factors. Cause. Cause is a condition that produces an effect. Eliminating a cause or causes will eliminate the effect. Contributing factors. Contributing factors are conditions that influence the effect by increasing the likelihood, accelerating the effect in time, affecting the severity of the consequences, etc. Eliminating contributing factors won't eliminate the effect. One way to discover the root cause of an incident is to use the 5 whys technique to ask why at least 5 times. For example, Blake fell while using a walker. Why? Because the handbrake was stuck. Why? Because the handbrake was still broken. Why? Because it was not fixed by maintenance yet. Why? Because they were backlogged. Why? Because they were short-staffed for the past 3 months. Using the 5 whys technique uncovered that the incident's root cause was staffing and maintenance, rather than a direct issue with Blake and his walker. By repeatedly asking the question, why, you can better understand what happened and identify the root cause. Types of cause and contributing factors. Process. Lack of policies, procedures not followed, or ineffective policy. People or human factors. Training, communication, scheduling, and other factors led to the incident. Equipment. Required tools to support people or carry out job tasks are not available or operational. Environment may contribute to the incident due to line-of-sight issues, etc. Materials. Needed supports are not available. Prevention plans. Once the person investigating has identified the cause and contributing factors, the team will create a prevention plan. The prevention plan identifies who is going to do what, when, where, and how. The prevention plan takes into account not only people issues, but system issues. Prevention plans can include various things, like finding better ways for DSPs to communicate with each other or adding necessary training to educate those involved. The prevention plan should address the causes of the incident that were discovered through the investigation and all significant contributing factors that contributed to the incident. The prevention plan should be shared with frontline supervisors, DSPs, and others who are responsible for implementing the system changes. Prevention plans are successful when they include clear and specific actions being taken. Instead of saying, provide training, a prevention plan should say something like, all residential and workshop staff will be provided training on Susan's new diet by July 18, 2025 by the program director. Elements of a good prevention plan includes involvement of the person and their guardian, as applicable, in the planning process. Shared across a variety of settings, and with everyone who supports the person within your organization. Has a holistic approach. May include technology, adaptation, and other supports. Balances what is important to, and for, a person. Clearly defines what the support is, why it is needed, and what is expected of staff. Not just a plan to plan, but is specific in identifying who is going to do what, when, where, and how. Includes a responsible person and timeline. Are within the control of a responsible person. Ensures that necessary resources are available. When effectively implemented, it can minimize the recurrence of an incident. The MUI cannot be closed until the county board has verified that all steps of the prevention plan have been taken as described. Remember that prevention is the key. DOOs, agency leaders, and direct support professionals are critical in the process. Team discussion. What does the team recommend based on the recommendation? Training. Who provides the training? Who is responsible for actions and reasonable timeframes? It needs to be specific with pictures and demonstrations. Assessment and evaluations. What were the results and recommendations? Person-centered plan. Are current discussions and risks clearly addressed? Dietary guidelines should be included if needed. Communication. How are changes communicated across all settings, documents, and with all staff supporting the person? Unusual incident logs, monthly review of incidents, annual MUI analysis. Prioritizing health and welfare. Individual service planning and risks. The agency provider and the county board ensure that risks associated with UIs and MUIs are included and addressed in the Ohio ISP of each person affected. Training. Provide initial and ongoing training to staff. Annual MUI training for all staff and includes health and welfare alerts issued by the department since the previous year's training. Abuser Registry. Established under Ohio law, the Abuser Registry lists the names of people who have committed acts of abuse, neglect, misappropriation, failure to report, or prohibited sexual relations. People who have committed an Abuser Registry offense and placed on the registry are barred from working with people with developmental disabilities for a minimum of 1 year. The Abuser Registry prevents persons who were DD employees from working in this field. It is one way Ohio protects its most vulnerable citizens. The actions you take can create and maintain a strong culture of health and welfare for the people we support.